In my early days of tutoring, I worked with a girl, I'll call her Jay for the purposes of this public video, and she was in kind of a scary situation. And the scary thing is that she went all the way through nursing school without failing a class, no problems, and then got to NCLEX, and she had failed twice, not once, but twice. And now she not only was she in danger of never being able to reach her goal of becoming a nurse, she was in danger of losing her job. She had been working a job that was so far being very kind to her and helping support her, even though she had failed twice. So she could no longer be working as a nurse under a provisional license. And they had placed her in a different role, but they were not going to be able to keep her on staff if she could not pass the NCLEX within a certain amount of time. And so she came to me for private tutoring, feeling desperate, and asked if I could help. So a lot of times it's hard in situations like this to fix the problem quickly because whatever's been going on has been going on for a long time. And she had to take the NCLEX. She was scheduled to take the NCLEX in about a month after we first started working together, which I wasn't sure, in all honesty, was going to be enough time. And it turns out, unfortunately, that it wasn't. She did fail the NCLEX a third time, but she did not give up. She persevered. She knew that she wanted to become a nurse, and she was willing to put in the effort and to do things differently until she could make it. And so when we worked together, we worked on her test anxiety, which obviously she had a lot of after failing NCLEX 3 times. And as part of that test anxiety, I have a lot of techniques and strategies that I use based on my previous experience in clinical psychology to help students conquer that test anxiety. And it's all available and included in my VIP tutoring membership that I offer now. So she was working on her test anxiety so that her test could be an accurate representation of what she really knew. And then we had to go back to the beginning because clearly she had some gaps in her thinking somewhere. Despite all of her nursing school, passing all of her classes, she still had not developed the ability to think like a nurse. And unfortunately, her story is not unusual. This happens to so many students, even some students who scrape by and pass the NCLEX, they still will struggle even more their first year as a nurse than they have to because they have not been properly trained how to think like a nurse. And so they have to learn it on the job in addition to learning everything else about the job. And I'm sure you have heard how stressful your first year of nursing can be. And so as we were working on this, she did such a great job. We went back to the beginning. We worked on the foundational information. We figured out what the pathophysiology was for each disorders in a way that made sense to her, that she could understand, that it wasn't just memorizing and putting on flashcards and highlighting textbooks and falling asleep, because let's be honest, that's all you're going to do if you study those techniques. But she learned to put together the information in a way that made sense, that she was going to remember long term. And the great thing about her story too is that obviously in only 2 hours per week sessions, which is what we were doing, I can't give her everything. I can't spoon feed her all of the information she needs to understand and put together for NCLEX. She has to be able to feed herself on her own this information. And so I was able to teach her the strategies on how to study, how to identify the most important information for herself, how to put it together in a concept map that made sense for her brain so that when it came time for a test, she didn't need any like fancy fake test strategies. She just knew the answer. And sure enough, when it finally came time, after a few more months of preparing, it finally came time for her to retake the NCLEX. She made it. She passed the NCLEX and became a registered nurse. And she is still working successfully as a registered nurse today. We are still in touch, and I love seeing what she's doing with her passion of being a nurse. So if you would like to have that same kind of support, and to learn, if you really have a desire to learn how to think like a nurse for yourself and not rely on professors to tell you what you need to study, not rely on YouTube videos to break it down for you, not even rely on a tutor like me to spell it all out for you. But if you want the skills for how to do that for yourself, and maybe even someday how to do that for a new nurse that's working under you, so that you can help, so that nurses start to help their young instead of eat their young, then you should consider joining the Your Nursing Tutor VIP tutoring membership, because that's exactly what we do. And we are a community of nursing students and that are willing to do that, that want to do that, and want to see each other succeed. So I hope to see you there. You can find me at yournursingtutor.com/VIP.